living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Drug and alcohol addiction can affect anyone, no matter income, education, or occupation. In fact, more than 21.5 million people in the U.S. have a substance use disorder, and experts anticipate that number will only get bigger. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Beth Brown, your host. If you or a loved one has a drug or alcohol addiction, it's important to know there is help and hope. Stay tuned. Welcome back. This morning we are talking about drug and alcohol addiction. Joining us first is Jeff Quackenbush and Thomas Risberg from the Rocky Mountain Treatment Center in Great Falls, Montana. Thanks for being here, gentlemen.
Thank you so much for having us.
So can we just start by talking how big of a problem is this really? Let's start with alcohol. What are the alcohol rates in the U.S. and in Montana?
So alcoholism ranges throughout the United States. We have roughly 25 million people could be classified as having some range of alcohol disorders. It's all on a spectrum. Montana is actually far worse than the national average. Really? You see about 8% of folks have a chronic alcohol problem, typically known as alcoholism, and then 1 in 5 are binge drinking at least once a month, right? So Montana, relative to the rest of the country, has very high rates of alcohol use. It's more normalized here, right? If you go to functions, it's sort of expected, right, that there's going to be alcohol there. And so we really do have a problem not only with the rates of alcoholism, but also the severity of it, is that we have folks here that are drinking every day large amounts and never have alcohol outside their body.
And is that because Montana is rural? Rates tend to be higher in rural states, is that right? Can you talk about why that is a little bit?
Absolutely. So some of those are going to be the environmental factors that, you have higher rates of poverty, low education, unemployment is typically higher in rural areas. But I think the real crux of it comes down to the lack of connection. There's kind of a buzzword throughout the United States now called deaths of despair. And those, encompass the overdose deaths, but also suicides. And, Montana leads the country in suicide rates. Mm-hmm. And so what I really think that's indicative of is these folks do not have connections, whether it be family, things in their community, faith community, employment. And so those all make you more susceptible to addiction and alcoholism. We say that for folks, it's a solution at the beginning, right? They're suffering from loneliness and isolation and depression, and this is a way for them to cope. And it, what starts out as a solution then, as we all very well are aware, has led to a lot of deaths and just untold pain and suffering.
Okay, so let's switch and talk about drugs and drug addiction a little bit now, especially opioids. We've been hearing about that a lot in the news, it's in movies. Is this a national crisis, opioids?
It is. I think everybody has a little bit of a relationship to it. My brother-in-law died of an opioid overdose in 2003, which was, of course, a while ago. He was prescribed opioids as a result of a surfing accident, broke his wrist. 3 years later, he's dead over an overdose. Mm-hmm. So it's very personal to everybody, and I'm sure everybody can relate to having somebody who's got this issue. So I think it's all over. So
you would agree this has hit Montana, the opioid crisis?
I think it's hit everywhere.
Yeah.
Absolutely. And so on the specifics there, Montana actually has a higher than the national average of prescription drug abuse. And, it's 70% of folks that get started on these, they are taking someone else's pills, right? So we kind of have this as the person in the alley, right? That's how you may think of. And that's just simply not the case, right? This is people finding it in their family's medicine cabinets. And so we really need to be aware of, they're starting to set up programs to do disposals, right? To take your prescriptions there. Because what this really comes down to is it's starting with grandma or uncle that, has a broken wrist and they prescribe him 60 Oxycontins and he takes 5, right? And then a curious, high schooler says, oh, I've heard about this, and there you go.
Yeah. So you kind of are alluding to this already. So healthcare providers are prescribing these painkillers, these opioid-based painkillers. So if someone is prescribed this, what's your recommendation there? What are tips?
So from the provider perspective, there really has been a shift, right? And prescriptions have gone down substantially in the United States. What the number one thing is awareness, right? It used to be that you would come in, in very minor surgeries like wisdom teeth, and they would give out, very powerful opiates in large quantities, right? They'd say, here's 60 hydrocodone, right? And no one is saying, look, there's a potential for abuse, right? Be very careful about this, And now you, as a matter of course, are going to receive an educational component about, hey, the rates of people getting addicted from this starting point is very high, and the length of prescriptions is way down, right? When you're coming in to get a first-time, prescription of any kind of opioid, you're typically going to see very short ones, right? They may do a 10-day, and so that doesn't give you the time, to develop that addiction and that tolerance, and it also prevents from, pills being, left around, right, so that they can get into the hands of other people.
So that's the good news in this. So if someone knows a person, whether it's alcohol or drugs, whether it's opioids or another kind, who they kind of suspect something's going on here, what's your recommendation? How do you approach a person that you think might have an addiction?
I would say start communicating that. Just start asking questions. We have 3 people on our staff that deal with that full time, taking phone calls and just starting the conversation, getting out there, talking to your support that you do have. There's a lot of support through NA and AA as well, and Al-Anon and Narconon. Those are great plans to just start the conversation, because once you start realizing it, you'll find you have the support, and there's people out there that are going through the exact same thing. And like we were talking about, isolation is the friend of addiction, and when you think you want to just bury your problem, it doesn't get better. So get it out there, start talking about it, and remember, it's just really, the statistics are alarming, but it's the person that you're living with or the person that you know that has this problem that needs to be dealt with, and that's one too many right there. So let's start with that one person and just try to get to understand that situation, and through those programs you can learn.
That is a great message, and we actually have to pause for a break, so we'll stop on that great message. Thanks for being here, both Jeff and Thomas. Appreciate your time and your expertise.
Yeah. Thanks, Beth.
Thank you very much.
So coming up next, we are going to talk about some of the different treatment options available for people who need help overcoming a substance use disorder or an addiction. We'll be right back after these messages. Don't go away. Welcome back. Today we're talking about substance use disorders, and joining us now is Jessica Shortridge, a licensed addiction counselor at the Rocky Mountain Treatment Center of Great Falls. Thanks for being on our show today, Jessica.
Good morning. Thanks for having me.
Yeah, of course. We're happy to have you. So let's start by saying, what's the difference between someone who is an alcoholic and someone who likes to drink? Are there characteristics there that you can pick out that lets you know for sure this person has a problem?
Absolutely, and they have to meet criteria through an evaluation that's extensive, that we're looking at biological, psychological, physical, environmental factors. However, a person that is not an alcoholic isn't going to question if they do have a problem as an alcoholic would.
Okay.
2 major questions to ask is, 1, has my use caused any major life problems? And 2, if I realized that my using has caused major life problems, was I able to stop using?
Okay. So if someone does drink only a few times a week, but when they do, it is excessive, is that person an alcoholic?
They very well could be. Again, it's what kind of problems is my using causing? And once I start, am I able to stop? And that really doesn't matter if it's someone being on a drinking spree for a week and going without months at a time. If they're drinking 3 or 4 drinks on a daily basis, it's really looking at what problems my using is causing me, physically, emotionally, spiritually.
Okay. And so if someone does have a problem, whether it's alcohol or drugs, why is it so difficult to ask for help?
as human beings, we really struggle with asking for help, and that's one of the things that I push, is that we are learning how to be able to ask for help. Nobody likes to believe that they're different from others. It's socially acceptable. Alcohol is everywhere, so it's a real struggle to ask for help. I can do this on my own. I don't need help. All of those factors. Tie
Independent.
into that. Yes.
Yeah. So if someone is suffering from alcoholism or has an addiction and decides to go into inpatient treatment, what can that person expect? What is that like?
Sure. I tell our clients all the time there's only one thing that needs to change, and that's everything. We are addressing the person holistically, mind, body, spirit. We're implementing structure. Education is power. So educating on the severity of this disease, educating the tools that are available, and then the most importantly is practicing implementation of those tools, because we've been using what we practice.
And so what's the difference between inpatient treatment and outpatient treatment?
The intensity, the level of accountability and structure, time is a factor. You know, there's 20 hours of therapy on average a week in an inpatient setting. Outpatient, the requirement is 9 contact hours a week, and that's typically going to be 8 weeks. So we can't stay, our jobs didn't keep us sober, our families didn't keep us sober, our houses didn't keep us sober, our bank accounts didn't keep us sober. Recovery has to come first.
Okay. And so if someone is getting treatments, what can they expect? What are some of the methods that you use to treat people?
Absolutely. The most dangerous place for us to be is in our heads. And so we're working on our thinking errors. We're working on identifying our feelings. This is called the feelings disease. If feelings are in control of us, we're out of control, and we need to learn to identify what those feelings are and change our behaviors. So we go through lectures, there's group, there's individual treatment, there's our family program, and then equine therapy.
Okay, so can you talk about that a little bit? What is that? What's equine therapy?
Our equine therapy, I'm more of the interpreter of what our clients get to experience with the horses. We're working on rigorous honesty. They're working on immediate biofeedback. The horses look right through our powerful behavior of wearing masks and putting on facades. They build self-confidence and self-esteem because they're working with a 1,000-pound animal. And if they can be successful with self-efficacy on learning how to put a halter and lead rope on and lead a horse around, it's a huge benefit to their self-esteem to help. If they can conquer and overcome those fears, they can do way more than that in life.
That is cool. So you talked about that your family didn't help, your job didn't help. So talking a little bit more about the family, what role does the family play then when it comes to treatment?
The family plays a huge role. This is a family illness, and this is a WE program. Our families typically are huge enablers, so they're continuing to facilitate the disease rather than facilitate recovery. So families being a part of the recovery process, getting involved in Al-Anon, it's a free program, getting connected, knowing that they're not alone in dealing with this disease, talk about it. This disease, again, the statistics are outrageous on who it all affects, and getting educated on what enabling is, what rescuing behaviors are, how to do things differently, and love the person, hate the disease, but facilitate recovery.
Can you talk a little bit about how your personal experiences have affected the way that you've been able to help others?
Absolutely. I've been in recovery from alcohol, methamphetamine, marijuana, opiates for over 11 years. And so I have the experience with the background of that. Been there, I've done that, and I can help walk through the struggle and get to the joy of being in recovery. That I tell our clients all the time, I will go through the blood, sweat, and tears right alongside of you. I'm not going to work harder than you do, but I work just as hard as you want to, in addition to the education that I've received to become a counselor.
So we just have a little bit of time left. Really quickly, if someone's watching and needs help, what's your advice?
Yeah, get out there and ask for help. The time is now. Don't procrastinate. Don't wait until you're in the emergency room. Put the shovel down. You've hit rock bottom, and it's okay to ask for help, that you're not alone in this.
Perfect, Jessica. Thank you so much. Appreciate your time.
Thank you.
So we need to pause it for another break, but up next, we'll be talking to a graduate from the treatment center in Great Falls, and we'll be right back to talk with her after this. Stay tuned. Welcome back. We're joined now by Molly McGonigal, who is a graduate of the Rocky Mountain Treatment Center in Great Falls. Welcome to our show, Molly. Thanks for being here.
Thanks for having me.
So can you start out by just telling us, when did you start using drugs and alcohol?
Yeah, it was around 16 when I really started drinking, and when I was in college, really started experimenting with drugs and got really into that whole party scene kind of thing. And yeah, so 16.
And then how often were you drinking? What kind of drugs did you get into?
Yeah, so it kind of they'd go through spurts of different things, really anything that I could get my hands on that made me feel different. I really loved that feeling. And so mostly alcohol, but also from 19 to 22, I had a pretty bad cocaine habit. I was going to college, so it made me feel like I could get stuff done, and I really didn't realize what it was doing to my body at the time either. So, yeah.
So when did you realize, was there something that happened that triggered for you, I'm in too deep, I need help, this is it?
Yeah, I was actually a very violent drunk. When I would drink, I was very violent, and that's not who I am as a person, and I just couldn't understand why it was making me act this way. And I woke up one morning from a blackout, learning that I had really physically hurt somebody that I really loved, and there was a gun next to me. So there's a couple times that I attempted suicide in blackouts when I was drinking, and so that was really a moment when I realized I'm not supposed to be 22 and have these things happen or do these things. It just really changed me.
So how did you get help then? How did you learn about Rocky Mountain Treatment Center? Can you talk about that a little bit?
Yeah, I grew up in Great Falls, but I was living in Bozeman at the time, and had graduated college, but I was progressing towards drinking like almost every day. And towards the last few months of my drinking, I was smoking marijuana every day and drinking every day and could not stop. So around New Year's, I actually had an incident and was just really physically sick. And so I literally Googled treatment centers in Montana, and then I had an aunt who came and helped me get things together, and she said, Rocky was the first one that popped up, and it's from where I'm from, and so I just, felt like I needed to call that Rocky Mountain Treatment Center. So
that's great. And so can you talk a little bit about what treatment was like for you?
Yeah, it was the hardest thing and the best thing, I think, that ever happened to me, just because they didn't just say, okay, after 30 days you're going to be recovered. They were very real about the fact that this is a lifelong thing and you're going to be struggling, but we're here to help you and walk alongside you throughout this process. And so the horse program was amazing for me. It really helped me identify how to trust people, it was just amazing. And so I learned a lot, but I really learned about the root causes of maybe why I am an alcoholic, why I am an addict, and the fact that I am going to be this for the rest of my life, and it's a thing I have to work at every day.
And so you talked about that the people at the center said that they were going to walk along with you. Can you talk a little bit about the support they provide?
Yeah, so they do an aftercare program. So once you graduate from the program, they have a counselor that meets with you and other graduates every week at the center. If you're out of town, there's a Bridging the Gap program that they really push that gets you connected with folks in recovery who are really trying to help just people with this massive issues. And so that was really helpful. And then on top of that, just there's a number of events that Rocky helps with, and they're partnering with organizations in Great Falls to just kind of help people in recovery identify that connection and maintain that feeling of hope, because it is a struggle every day for all of us in recovery, but if we can do it together, then it's much more fulfilling and easier to handle.
So how long have you been sober?
So this is a tough one because I did, graduate from Rocky at the end of February, of 2018, and then stayed sober for a few months, had a slip up, and then last December I had another slip up, and so I'm not going to say that I was fixed right after treatment, but it did teach me the tools and the people that were in the treatment center and who I was able to create the relationships with were right there to help me and tell me, you're not a bad person because you messed up or you made a mistake. You can rise from this and we will help you. And so I've really honed in on the aftercare program at Rocky even a year after, because it's there for me to be able to focus on my sobriety.
So what are some of the obstacles that you stumbled on, would you say? Can you talk about just the struggles of trying to stay sober?
I think for me, the hardest thing is that I'm 25, and so I started trying to get sober at 22. And just being younger in sobriety, I think, has been a struggle for me personally, because so many of my people that I was friends with are still out there partying and doing things, but most of them, have a stopping point. For me, if I go out and want to party or be socially acceptable, it just never happens. I'm always the drunkest person, or I'm always, blacking out, or something bad is going to happen. And so feeling different, I guess, is another thing, but really just maintaining the fact that this is a day-to-day thing and that there are so many people in sobriety that want to help me, and it doesn't matter your age. It doesn't discriminate. And so I think that's been a struggle, and maybe just feeling a little alone, but that's, with the territory of anyone's life, we all struggle with that. So
we're very close to being out of time, but I just want to end on a note of hope. Before treatment, after treatment, what's the biggest difference in your life right now?
Honestly, my faith, I would say. This program at Rocky Mountain Treatment Center really brought me back to the fact that there's connection and that spirituality is a big, big thing for people in recovery. And I can walk through every day. There's struggles and there's trials and tribulations, but I have that faith base to come back to, and it just gives me this amount of peace that I've never had in my life before. So
awesome.
Yeah.
That is great. Molly, thank you so much for being on this
you.
morning and for sharing your story and being a story of hope for others.
Thank you.
Appreciate
so much.
it. And thank you so much for joining us this morning. We hope you'll come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. We'll see you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.